Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Hello, I'm Dr. Katarina Woodard, and today I'm going to be talking about day one physical assessments. Really how we should be setting the standards for our patients, because all too often our patients will come in and they just don't move well. This is a huge indicator of what their health outcome is going to be like. And if on day one we can make them aware of that, we can bring it to their attention that their movement is most likely, more than likely, the cause of a lot of their symptoms, then we're going to see better results in the long term. We're going to feel better about ourselves because we were honest and upfront in the beginning, rather than treating them for 3, 4, 5, 6 months and then coming back and saying, well, we really need you to exercise as well, on top of the stuff we're doing here in the office. This is a topic I could talk way too much about because I'm extremely passionate about movement, exercise in regard to health, but let's get into it. All right, so day one assessments. Like I said, they set the standard for what we're going to expect health outcome when it comes to our patients. Not only for us to see where our patients are at physically and to really take a full look at what's going on with them, but also for the patients to say, hey, this provider is really looking deep into my symptoms. Because we can learn a lot on day one, and with it setting the standards, we're not skipping things. Like, we're not skirting around the topic of, hey, exercise is going to be very important for this health outcome that you're looking for. Or, hey, if you're sitting in a chair in front of a computer for 8 hours a day, we know that this is going to be leading to X, Y, Z symptoms. So we're setting those standards early. We're having those conversations early, and we're looking for it all on day one. A lot of the assessments that we do, I know a lot of people have seen. And these are things like maybe a squat exam, a posture scan, the insight scans, and of course, x-rays. These are all things I've done with patients before to assess where they are at physically. They come in, they're going to tell us we have this, and this going on, and we're going to take what they're saying, and then we're going to put our detective hat on and figure out where things are coming from so that we can give them the best answers possible. So these are all things that we're used to seeing. I want to make sure a patient can squat. This is a basic human function. Even when we are in our 80s and our 90s, we need to be able to squat down down to the toilet and then up off the toilet. Having leg strength is definitely researched when it comes to regards to best health outcomes as we age. Posture is going to show us where things might be hypermobile, where we might be compensating because of that. Even having a patient move, we can look at how they're standing and start to make some assumptions. I see it all the time. Those rounded forward shoulders, either belly button poked out or tucked super in. We've all seen it before, these classic signs of, I can see someone in the mall walking around and say, you're more likely to have low back pain. Making a patient aware of this is so important. Also, areas of hypertension. Hypertonicity, I should say, not hypertension, but hypertonicity, like the traps, up, forward, we're sitting in front of a computer, things like that all day. And then the x-ray piece. I have x-rayed for years. Whenever we see breakdown of a joint, we know that did not happen 2 weeks ago. So it's good to identify it for a patient to say, hey, look, you have loss of your cervical curve, loss of your lumbar curve, or this discrepancy in your hip, and you also have arthritis and breakdown of this joint, which tells us this compensation pattern has been going on for a very long time. And it's going to help them understand their symptoms better. But we also want to know things like, can you get down and up off the floor? If you were to fall How quickly would you be able to get up off the floor? This is a basic assessment for, do you belong in a nursing home? Also, can you lift 20 pounds overhead? How often did elderly people come to me as patients and say, I can't pick up my grandchild or hold my grandchild? That's going to lead to breakdown of their body if they can't do basic lifting of weights, reach up into a cabinet and pull something down for themselves, like a heavy glass bowl. Can you run a half a mile without stopping? I unfortunately know too many people that cannot do this, that can't even sprint 100 meters. And I may seem a little bit harsh when I say this. I don't mean to. There is a standard for health. Of course, if someone has a handicap or something like that, we're going to have to take that into account. But there's basic standards for health of like, we should be able to run at least a half a mile without stopping. Mobility without control equals instability. And I want to say we see that more in women, but there are some men that have hypermobile joints and they're more unstable, which can lead to more breakdown, and we'll see more symptoms associated with that. But also, almost more often we see it in men, but we also see it in women too. Stability without mobility. We watch them go for a squat, they go completely forward, or we watch them try to raise their hands overhead and they can't get their arms past their ear. This is going to show us where we're going to be compensating with their muscles. Now, why is strength and movement so important? Patients say, well, I walk every day. And I am not an anti-walker. I do love walking. I think being outside, walking, breathing fresh air, taking a break from in front of your computer is so important. However, basic walking around your neighborhood or down the street is not going to move the needle when it comes to adaptive physical changes. It is a basic human function. You should be able to walk. That's a huge sign of health. So it's not necessarily an exercise unless you're actually pushing yourself. So granted, take someone who's hundreds of pounds overweight, been sitting on a couch or in front of their computer for years and years and years. Early on, walking might be a big step for them. But we can't stop there. When it comes to, if I'm asking a patient, are you physically active? I'm going to look at that patient, assess where they're at, and if they tell me, well, I like to go out for walks, I'm going to ask them, can we do something that moves the needle a little bit more? I ask them that lovingly, not to be harsh, because I know that all too often people look at me and they say, well, you're an ex-athlete, it must be easy for you. But I'm not asking you to go be a CrossFit Games champion. I'm not asking you to go win a powerlifting meet. I'm asking you to just push your body enough to get your heart rate up a few times a week, enough for your body to make these healthy physical changes that it's supposed to. Because when it comes to like evolutionarily speaking, we have to be strong. Strength training builds muscle and force production. Now, I'm not asking you to deadlift 500 pounds. I'm asking you to be able to pick groceries up off the floor, out of your car, and be able to get them into the house. So strength training is only going to support this for you to be able to do that long term. Then there's things like aerobic training. The zone 2 builds endurance, so great for mitochondrial health, also metabolic health, also detoxification with consistent breathing. And there are videos and videos and books on zone 2 training for athletes. This is the training where you're just getting uncomfortable and you can still hold a conversation, but you may have to take a few more breaths as you are biking, swimming, or even fast walking. Rucking, walking with some sort of load, can be considered zone 2 training. And it's different for everyone. A professional Ironman zone 2 is going to be so much different than a sedentary desk jockey. So having something like strength building, aerobic training, and anaerobic interval training is super important. When it comes to the anaerobic interval training in a patient's life, this builds power, resilience, metabolic flexibility. It supports hormones. It supports cortisol. It supports detoxification, mitochondrial health as well, but also helping our body get rid of inflammation, helps our body regulate better. If it's not a challenge to the system, it's not going to change the system towards health. So if someone comes in and they're having extreme back pain, and I see a lot of people that do manual labor, like construction work. That's hard. You are moving all day, but that's still walking, not pushing your body, pushing towards adaptation. I am still, unfortunately, going to ask them to incorporate some sort of exercise. It does not mean go get a personal trainer and join an extremely expensive gym. That means just have some weights at home that can force some adaptive changes to you physically. Evolutionarily speaking, we're designed to lift, carry, climb, sprint, escape danger, hunt, and walk really long distances, even while carrying stuff. When it comes to exercise and when it comes to physical capacity, I truly believe that evolutionarily speaking, we should not evolve to be more adaptive to sitting on a couch and sitting in front of our computer all day. These are all basic human functions that, yes, offends patients sometimes whenever we ask them to do these things, but it shouldn't be. It should be an understanding that these are basic human functions. You should be able to lift something within reason and carry it. You should be able to lift your body weight a little bit, enough to be able to climb. You should be able to sprint, something that goes away so quickly, especially as we age. But if you don't use it, you lose it, and you cannot sprint anymore. The amount of people I've talked to that are like, I don't think I could sprint 50 meters. You should be able to have the ability to do something like that and walk for extremely long distances without having to sit down or take too much of a break. When I say long distances, at least 45 minutes to an hour of walking to have that aerobic base. This is so important because whenever we have a mismatch in this, meaning people don't have this capacity, that's where we see more dysfunction, more adaptation, and more negative health outcomes with these patients. And again, I'm going to say it at least probably one more time during this presentation. I'm not saying it to offend a patient. I want to meet them where they're at and lovingly say, these are the things that we need to be able to do for health. All the research shows that we need to be able to do these things. So we need to be able to assess our patient's ability to do those things so that whenever we have the conversation with them, they can say, this provider is honest with me. At least they're not just skirting around the fact that I may need to lose some weight or I may need to exercise. They're being honest with me. And at the end of the day, it's going to make you feel better because I'm going to assume more than likely you know that these are foundational for health and any health outcomes that we want to see from our patients. But doc, I'm here because of pain, not because of exercise, not because of lack of exercise. My back hurts, or my neck hurts, or my shoulder's been hurting for years, or my knee hurts. There's a famous physical therapist that has a quote that I use on patients a lot. I will tell patients a lot that is always the victim that cries out, never the criminal. What that means is what you're feeling is the symptom. Something is causing that, and that's the criminal. Something being, it can be your low back pain, and that can be coming from poor hip mobility, poor movement, weak core, weak glutes, and then that's leading to our back pain. So if I lay you down and adjust you, or if I'm solely focusing on your lumbar spine and what's going on there, and I'm not paying attention to the criminals, those weak glutes, that weak core, that poor movement, then I'm only paying attention to the victim, and the criminals are going to keep doing what they do. That's the same when it comes to shoulder pain. Poor thoracic mobility. You know how many people cannot rotate or fully lift their arms overhead without compensating with their low back? Shoulder mobility, shoulder pain, scapular instability, impacting breathing mechanics, that forward rounded, tight pecs, all that, weak rotator cuffs. Those are the criminals. The victim is your shoulder. Same with knee pain. Glutes go along with knee pain too. Limited ankle mobility. How well can you squat? If you're squatting consistently, that's all you need for ankle mobility. If you're walking consistently, that's what you need. However, we sit too often. We have poor hip engagement, poor control, and then load mismanagement because of compensation patterns. And of course, we're going to end up with knee pain. Same with neck pain. forward head, look in front of a computer, tight pecs, weak rotator cuff. That's going to lead to what we see on x-rays. It's going to lead when we see this hypertension because we have that upper cross syndrome. It's so important that patients understand this, and I'm so big on educating my patients that I can adjust you all day, and it is a powerful thing for me to be able to do, but if we don't take and get rid of the things that are contributing to this pain, then that's just going to keep coming back. And you having education on that is going to be huge when it comes to you getting better and not having to deal with this issue long term. And that's where we build like trust and rapport. And honestly, it makes me feel better as a provider, knowing I'm being honest with my patients and I'm saying, we need to exercise these joints. Here's a band. Here's a way we can make adaptive changes so that this doesn't come back long term. Then there is the lab work piece of this. What is our physiology saying? Can we assume that something's going on with their thyroid or their cortisol or their nutrition that's limiting their ability to do basic things like run a half a mile or exercise or want to exercise consistently because their body's so stressed or their body's so stressed or poorly fueled that they literally can't develop the capacity to do these things. So we can look beyond movement when it comes to what's their ferritin. Do they have poor oxygen delivery? That's going to lead to fatigue and inflammation. That's that rust in the body that's going to make them not feel good exercising or actually almost make them feel worse when they do try to exercise. What does their hydration look like? Hydration is so important. Their mineral balance is so important for being able to feel comfortable exercising, to be able to heal, to recover from that exercise. So it's something that they want to continue to do. What is their glucose? That's going to include how is that impacting their inflammation, their recovery, their sleep, their weight, any other red blood cell abnormalities. We can even get into like the genetic piece of this when it comes to oxygen transport and their ability to exercise. Hormones, poor muscle mass, we know this through research, muscle is the key for longevity. There's so much research on this. And as our hormones start to deplete, both men and women, that's going to lead to more poor muscle mass. So that's where we have that conversation with our patients in their 30s and 40s. Hey, you need to prioritize it now because it's a lot harder to prioritize when you're in your 60s and your 70s. The internal environment dictates how well someone can adapt to any health change. And I know this is all about exercise and movement, but how well their labs are showing up in our office, and some people come to us with their labs already, that's going to dictate how well we can get them on a better exercise plan. So it's important to know if you don't do lab testing or if you don't do any blood work, if you know ahead of time things that they have said in the past. Oh, I used to be anemic, or I'm postmenopausal, or I only eat about 1,000 calories a day. I wake up and the first thing I do is drink coffee, and I probably don't eat until 2 o'clock in the afternoon. These are all things that are telling us that the internal environment might hinder or is going to hinder their ability to move and exercise. So this is why your day one assessment sets a standard for everything that follows, because it's going to really help identify a root cause. Not just, you're in here with back pain, here's an x-ray that shows that you have this joint going on, this joint issue, your hip's high on this side, or you have degeneration over here, or we see an MRI that shows this over here. Yes, those are the symptoms. Those are things that happened because of some sort of stimulus onto their joint or lack of stimulus onto their joint. It prevents you just chasing pain, because whenever we have this conversation with patients and it's all about pain, pain can go away within 2 weeks. But if you've seen the road to recovery, things start to come back. If you have the conversation with them of like, we need to build something and get their mindset off of pain alone and get their mindset more towards preventative long-term care, they're going to be more compliant in the long run. You're going to have a better patient relationship, and you're going to feel better about the treatment that you're doing for this person, rather than their neck pain and their headaches are gone now, and then I'm not going to see them until they come back. It also matches the plan for the patient's true capacity. I've seen patients come in before that literally can't get down onto the floor and back off the floor. So it's going to tailor my rehab for them. It's going to tailor my treatment for them because now I know you can't do these things. It's going to also create a faster, more predictable outcome, reducing the chance of re-injury and setback. Education has been proven. If you educate a patient and they know why they have these issues going on, they're way less likely to re-injure that joint. We know the physiology of back pain and how back pain continues to come back if we're not rehabbing it properly. If a patient understands that and they start to feel these, oh, I'm not engaging my glutes like I should be, or, oh, I didn't engage my core whenever I bent over, then they know, oh, my doctor was right, I need to handle these things. And they're educated enough to be able to take care of that for themselves. And my most important thing is I want my patients to trust me. I want them to know that I have their best interest in mind when it comes to their health. And that's why I'm so passionate about going over the physical part first, early on. Not just, oh, you have pain, I'm going to fix that. And then in a few months, like, yeah, you probably have pain because you can't bend over and touch your toes or you don't engage your core properly whenever you tie your shoes. Like I said, a topic I could go on and on and on about, but I want you to understand the importance of assessing your patient physically whenever they first come in. Don't just look at them as someone who's coming in with pain or some kind of unhealthy basic marker. Look at them as a full person. How well can this person move? We know movement is the key to life. So we need to assess it on the first day. If you have any questions about this, please feel free to email us, reach out. I love this topic. There's so much information on more detailed tests that we can do besides just the basic posture screening or squat screening. It's really just sitting down and getting to know your patient, getting to know where they're at, and then communicating that back to them whenever they come back in. I hope this helps. Enjoy the rest of your day.